This is the ABC7 SoCal Spotlight, sponsored by IEHP and LA Care.
Hello there. After the last 20 months of COVID, most of us have had healthcare on our minds, it's fair to say. Well, today we are going to shine the SoCal spotlight on two of Southern California's health plans, both of which have gone above and beyond to keep their members and the communities where they live safe. LA Care Health Plan serves residences in LA County and currently has more than 2.4 million members. Inland Empire Health Plan serves residents in the Riverside and San Bernardino counties exclusively, and they've got 1.4 million members. Both took extra steps to ensure their members stayed healthy during these challenging times. Joining us now is IEHP Senior Medical Director, Dr. Ernesto Campos, good to see you. And from LA Care, their Chief of Equity and Quality, Dr. James Kyle, good to see you both. Dr. Campos, I want to start with you. What has IEHP been doing to get those vaccines into people's arms?
A few things that we've done over at IEHP is we actually talked to our member services team about addressing phone calls when they actually come into the health plan and helping members by providing information and helping them schedule vaccines. Secondly, we have a texting campaign. We are the one health plan that we actually took the opportunity in partnering with San Bernardino County to provide a vaccine clinic at our headquarters.
Dr. Kyle, what about LA Care? What have you guys been doing?
Well, doing certainly outreach to all of our members, let them know how dangerous this virus can be. We're collaborating with community clinics. We now have 70 sites where we've been allowing people to get vaccinated and providing that for them. Maybe 100,000 people have already been vaccinated by this, but we're not satisfied. We're still trying to find ways to go after the community to make them understand the importance of this vaccine and feel safer about getting the vaccine.
Dr. Campos, what are you doing to make sure that your community out here and your members are getting the facts?
From IHP standpoint, we've actually put out webinars both in English and Spanish to try to address myths and misconceptions about the COVID-19 vaccine. We actually have also public service announcements featuring African American physicians and Latino physicians to again encourage that information, that appropriate flow of facts.
Dr. Kyle, we already know that communities of color in this country are disproportionately affected, not just by COVID-19, but across the board. And yet we also are learning that many communities of color are hesitant in getting this vaccine. So how do you weigh that up?
There's legitimate reasons for people of color to be fearful of the healthcare system based on its history. They have been mistreated in the past. So when you ask people, trust me, I'm a doctor, that sometimes does not work. Once you talk with them as intelligent adults and say, here's what's really going on, they make the right decision and they get vaccinated. So that's what we have to continue to do.
Well, and look, it's not all doom and gloom. 70% of Californians are fully vaccinated, which is fantastic. Obviously, there is still many, many people out there who need this. And now, on top of that, Dr. Campos, we are coming into flu season. Are you concerned that people, this hesitancy to get the COVID vaccine is going to spill over to the flu vaccine?
Well, there's always that concern. It's something that we've seen in the past. But I think the medical community right now is really trying to come together. And again, that's what Dr. Kyle and myself are here for, to try to promote the well-being and the importance of getting vaccinated.
Dr. Kyle, what's LA Care doing to prevent, I think it's called a twindemic?
We're doing very similar work. We're trying to do flash stand-up clinics for flu. We have our 10 resource centers that are also doing vaccine programs.
Now, something that I think a lot of people don't think about when we talk COVID-19 is food insecurity. What has LA Care been doing to make sure its members and its communities are getting the nourishment and the proper food they need during these difficult times?
We're setting up food pantries at our community resource centers in conjunction with Blue Shield Promise. We're looking at how we can get food out into the community, food as medicine. Food insecurity is a major issue, and we're doing what we can to encourage people to collaborate with us to get food that they need to feed themselves and their families.
Look, there's a lot of great information. Dr. Kyle, Dr. Campos, thank you so much for taking time out of your incredibly busy days to help chat us and talk through all of this. If you want more information on what we've discussed in today's SoCal Spotlight, we're going to put the websites for both health plans up on the screen. We're also going to put their phone numbers up there so you can reach out by the website or the phone number. That is going to do it for today. Until next time, stay safe, take care of each other. We'll see you soon.
This has been the ABC7 SoCal Spotlight, sponsored by IEHP and LA Care.